Hello everybody, Dr. Shelley here from Synergy Chiropractic. Today we are going to talk about proper sleep hygiene. Many patients have commented that they wake up in the morning and that's when their pain is the worst. So we have to make sure we are sleeping in the best possible, the most optimal spinal position to eliminate or decrease the amount of morning pain or even the pain that is waking you up at night. So the first thing we're going to talk about is no tummy sleeping. That is a complete no. So if you are a stomach sleeper and you're going, oh, then start thinking about how you can encourage yourself to get off of your stomach. So option number one is going to be lying on your back. But we can't lie on our back just straight across. Here, let me move these pillows down for a second. If you are lying straight across your mattress with your legs out straight, you're going to actually cause the arch of your back to arch even more because your feet are drawing you down towards the bottom of the bed. So what you want to have is a nice bent knee and a flexion in your pelvis. And as soon as you do that, your lower back just relaxes down and flattens into the mattress. And it takes a lot of the pressure off of any type of disc protrusion, herniation, bulging, and also decompresses the facet joints of the spine that also may be giving you the back pain. Now obviously you're not going to be able to sleep just like this, so what you're going to do is layer some pillows underneath your knees. So you can do one, or even better is two, underneath your knees, and then you can let your legs be up in that position and your lower back will be relaxed and supported. You can put a small rolled towel underneath your lower back as well, but you may not feel that is necessary. Now, talking about a rolled towel, if I was not on a pillow at all, this curve of my neck would be left open and vulnerable, nothing supporting it. So one of the options is to take a towel and roll it up so that it's just the right diameter to fit underneath your neck. So this is just two hand towels rolled together, and you can keep it secure by putting two elastic bands around it. But you're just going to put it underneath your neck, and you can see how nicely that supports my neck. So my lower back is nice and flat and safe, and my neck is nice and straight. So if my rolled towel or my pillow is too big, so let's imagine it's like this, and I put it here, look at how my neck is on an angle, and that's not good. It's tractioning my neck forward, and that's not at all what we want. We want our spine to be neutral and parallel to our bed. So not up, not back, and not straight out like this. Okay, so that's back sleeping. Now, for some of us, we prefer to sleep on our side. So let's talk about some safe ways to do that. One of the hiccups with side sleeping, I'll put that down, is when you're on your side, you can tend to take the upper leg up and over. So we're all twisted through our lower back. So that's taking the lower lumbar joints and even the sacrum, and you're putting a torque and a twist, and guess what? That disc is in between those vertebrae, so you're putting torsion on that disc area. So we can't have you in this little fetal, half fetally position. You want to try to keep your knees stacked on top of your knee. But if that's not comfortable, you don't like the pressure of the knee, then another good option is to slide the pillow between your knees. So the pillow goes between the knees, and it's stopping you from rolling it forward. Now some people, remember I talked about no sleeping on your tummy? This is a way to help you get off of your tummy. This is a pretty big pillow, but you could even have a longer one, like the nurse breastfeeding pillow, or body pillow, I believe it's called, those long thin ones. So you bring it up so that your arm goes around it, and can't quite get this to reach, and your knee goes around it, so that you're feeling a little bit of that comfort against your chest and your abdomen, but the pillow is stopping you from getting over onto your stomach. So my hip is still nicely supported, My back is not rolling forward, and I do feel like I've got the pressure against my abdomen that you might be desiring if you are a stomach sleeper. Now the neck. So I've kept this roll underneath my neck, so you can see that everything is pretty straight. So if I get rid of the pillow, just for visual, so you can see everything is straight. Now there's certain pillows out on the market that can help you, but I know it's very difficult. Many of you have pillows that are in your closet. It's like a little pillow museum. Some are good for you, some are not. But some of the things you can look for is a cervical pillow is going to have curves in it. Sometimes it's good to get one that has two different sizes, the small end and the big end. So for me, between my ear to my shoulder is not very big, so I would be using the small roll. Make sure I put it properly. So if I were to lie down on this one, well, it's not so comfy with the plastic, but you can see that the roll just fits perfectly in my neck, and it's lovely and straight. So again, if your pillow is too thick for you, you're going to be lying there like this. And if it's too thin for you, you're going to be collapsed down like that. So you want something to fill in the gap to keep you nice and straight across. Now, the cervical curved pillow is one option. I know there's also some gel-filled pillows out there on the market, which may be nice because it can add some of the cooling effect. Us ladies tend to like to be a little bit cooler at night after a certain age. But there's also, I personally use a water pillow. So there's a bladder underneath that you fill with a certain amount of water that allows your pillow to be the right height and the right firmness for you. So it's kind of like a custom pillow. It takes a few weeks to get your perfect desired level, but it's worth it because once you get it, these pillows last for a long time. So that's another option that's out on the market for you. I hope some of these things are helpful to you. If you have any further questions or anything at all, you can just email us at info@synergychiro.net, and I would gladly get back to you and give you some further guidance on how to have a proper and healthier sleep hygiene so that your mornings can be a little bit more cheerful. That's all for now. Stay well, friends.